Good morning, everybody. Thank you so much for joining us for today's event, Advocacy in a Virtual World, sponsored by our beautiful sponsors that you saw previously and in collaboration with Healthy Mothers, Healthy Babies Coalition of Georgia and March of Dimes, Georgia. I know we would love to have all of y'all in person, as we typically do at our policy breakfast every year. So we really appreciate you all taking the time out to join us in a more virtual platform. We have a jam-packed day for you all. We will start off with an overview of legislative priorities for March of Dimes, Georgia, then an overview of legislative priorities from Healthy Mothers, Healthy Babies Coalition of Georgia. We'll then move into a pre-recorded panel from our legislators to really get you excited about things they're working on that'll help moms and babies across the state. And last but certainly not least, we will have our advocacy training as well as our awards for our legislators of the year. We really want this event to be an opportunity for you all to be engaged. This is a session like no other. I'm sure we can't reiterate that enough for everybody. And despite everything going on with it being a virtual session, limited access to the Capitol, we still want folks to be engaged and to be informed and to feel well equipped to advocate on behalf of moms and babies across the state of Georgia. So a couple of housekeeping rules. I'm sure a lot of folks are familiar with Zoom, but if you have any questions, please put them in the Q&A function as opposed to the chat. But we do want you all to be very engaged in the chat. We want to have conversations, and we'll be saving the chat so we're able to review it at a later date, so we can just see if there were any themes that came up or any suggestions or feedback, just really seeing what you all are excited about and what's got y'all pumped for this session. So without further ado, I will turn it over to Vicki Melinda Moreau to give an overview of March of Dimes priorities.
Good morning. I'm Vicki Melinda Moreau, the Executive Director for the March of Dimes in Georgia. Good morning. I'm Vicki Melinda Moreau, the Executive Director for the March of Dimes in Georgia. The March of Dimes has had decades of history of advocating and working on behalf of the health for all moms and all babies. If you remember, we're the organization whose research led to the polio vaccine. We're the organization who helped to develop the Apgar test that all babies, regardless of their health, take within their first few minutes of life. We are the organization that helped to find out that folic acid is beneficial to all pregnant women. So when I say that March of Dimes loves to take credit for not only our babies that are born premature or babies that have had some type of birth defect, but also the healthy ones, because it's due to the research that we've done over the decades that March of Dimes knows that it is important that all moms and all babies are healthy. As many of you know, in Georgia, we have an urgent maternal and infant health crisis. Georgia is one of 7 states that has one of the worst track records for maternal and infant health. March of Dimes annually promotes or does the research to develop our annual report card, and we share that with all of you. Unfortunately, in Georgia, we received an F again this past year. And for the last 4 years, we have seen that our prematurity rates have continued to increase. In 2019, we were actually in a situation where 11.8% of our children, our babies, were born premature. And this is important because premature birth and the effects of prematurity really are the leading cause of babies dying before their first birthday. In addition, we know that in Georgia, out of our 159 counties, approximately half of them do not have access Our pregnant women do not have access to obstetric care. And we know how important the care of our moms is when they are pregnant. We want to make sure that we no longer have these maternity care deserts. So these are the reasons that we're here today, to see what we can do collectively and working with organizations like Healthy Moms, Healthy Babies in partnership to make sure that babies are healthy and moms are healthy. March of Dimes, as I mentioned, has a real history of research. We also have a history of creating educational programs for healthcare professionals and families. And last but not least, it's our advocacy work and our legislative efforts that we know are a really important piece to making these changes for all of Georgians. Our partnership with Healthy Moms, Healthy Babies has lasted for many, many years. And it's through the work of this partnership and collaborating with other partners in our community, with people like you that are listening and real supporters of this work. Our legislative partners, our legislative consultant is Betsy Bates, and she's worked tirelessly with Danielle Brown from the March of Dimes over the last several years to make sure we have several advances for maternal and infant health. And we couldn't possibly do this without our legislators that are working tirelessly to make sure that Georgians are taken care of. I'd like to recognize our most significant accomplishment in 2020, along with Healthy Moms, Healthy Babies, and several of you, with HB 1114 to fully fund the Medicaid extension for 6 months postpartum, which will start actually being implemented in July of this year. That almost $20 million worth of funding will really go a long way to help the health of moms and babies in Georgia. So we are really proud of that accomplishment. So as we gear up for 2021, we want to make sure that we go into I would like to show you some of the slides from our 2021 legislative season and what we are planning to accomplish. So the first is to defend and protect. This is a category. As I mentioned, we've been working together for the last 5 years for sure on some of these efforts. And we want to make sure that there are no setbacks. So we want to oppose any cuts to maternal and infant health that we've gained over the last years in programs in the state budget. We also want to make sure that we are continuing to have the conversation about a full expansion of Medicaid coverage for moms past 6 months, all the way to extension to a year. We don't anticipate that that will be something that we will take up in this 2021 season, but it's something that we want to keep on the forefront as we really measure the progress of what we've accomplished as we go into the 2022 season. So defend and protect is about making sure that all of the work that we've accomplished previously together continues and that the budget is in place to really make sure that Medicaid is available for more individuals, more Georgians, both moms and babies. The next slide talks about what we want to do to begin to transform, to make sure new initiatives are in place and new legislation is in place to help with the health of moms and babies. So when we think about what we've accomplished so far, one of the things is around maternal mortality and morbidity. And so there has been a maternal mortality review committee. We'd love to have something similar for infants. So the fetal and infant mortality review program is something that we want to work with our partners at the Georgia Department of Health to, as well as many of the partners in the state, to make sure that we can clearly understand and review systematically what are some of the trends and consider recommendations to improve fetal and infant health, just as we have done for maternal health. One of the other areas, when we think about what we are undergoing right now with the COVID pandemic, we want to make sure that moms and pregnant women and their infants are able to get the care that they need and the vaccinations. We know that pregnant women, for the most part, were not included in the trials. So we want to make sure that we are working to make sure that the vaccines are available to this underrepresented group and that they will be healthy. We want to work to continue policies around telemedicine. One of the real positive benefits from a health perspective as a result of the pandemic showed us that telemedicine can work. And so we want to continue to advocate. We actually had some success this week with HB 307 that was put into, it actually passed the House. It actually came out of committee, I meant to say. Our representative partner, Representative Sharon Cooper. It actually came out of committee yesterday, her bill on the Georgia Telehealth Act. We think that this will go a long way in promoting telemedicine to address the maternal deserts that I spoke of. It's almost 50% of our counties are maternal health deserts without obstetric care. When we talk about create paid family leave systems, HB 146 is another bill that was presented by Representative Gaines. And that one actually passed the House yesterday. And that is a bill that will give 3 weeks of maternal leave for state employees and some Board of Education leaders. And the last bill where we've had some success this week was HB 163. Another bill that was presented by Representative Cooper, Sharon Cooper. And this bill will automatically enroll kids in Medicaid. What a great opportunity to make sure that our children, our moms, and our babies have access to the care that they need immediately. And last but not least, when we think about addressing social determinants of health, one of the things that became very obvious to all of us were the health inequities as a result of this pandemic. And so at the March of Dimes, we have opportunities with one of our new curriculums around implicit bias to make sure that racial disparities and health disparities that are created based on the color of someone's skin, we can begin to alleviate some of those issues. So in closing, I would like to say that we are thrilled with our partnership with Healthy Moms, Healthy Babies, with all of you, with all of our legislative partners. As I mentioned, I'm the executive director for the March of Dimes, Georgia, and I'd like to introduce by sharing her contact information today. We now have a new director of maternal and infant health for our collective impact efforts, and that is Tamara Mason. And either one of us can be reached if you have an interest in joining the partnership with March of Dimes and all of these amazing community partners that are advocating for the health of moms and babies. I'd like to now turn it back over to Amber as she shares the priorities, the legislative priorities.
Thank you so much, Vicki. As Vicki mentioned, we are really proud of our partnership with March of Dimes and organizations across the state, and even some national organizations on a lot of the priorities that Vicki mentioned. So we're happy to support there. I will now present our legislative agenda items for this session. Starting off, we are prioritizing saving the funds for maternal and infant health. Last year, we were really fortunate to see that a lot of the money that was on the chopping block that would affect maternal and infant health programs was retained. And we want to create an environment this session where legislators understand the importance of maternal and infant health programming, specifically programming in DPH, but across the state and across different state agencies. These programs are really vital vital to the health of moms and babies in our state. They provide things like newborn screening, family planning assistance, group prenatal care, um, resources around neonatal abstinence syndrome and just any substance use that mom may be experiencing, whether that be illicit substance use or alcohol or smoking or anything of that nature. And then just generally having resource access for folks. We know that COVID-19 has had a negative impact on our state's budget and in some instances our state's revenue, but we don't think that this is the time that money needs to be cut for programs that are vital for our moms and babies, especially considering the fact that moms and babies are experiencing mental health concerns as well as physical health concerns as a result of the COVID-19 pandemic. Next, we prioritize extending the coverage of postpartum Medicaid to 12 months. We're really happy and really grateful to see 6 months during last year's session. And while, like I said, we're really grateful for that, we know that the postpartum period does not just end at 6 months, just like it didn't end at 60 days before it was extended. It's for the full 12 months at the very least. Moms need time to recover from birth, to manage any comorbidities that they may have experienced, whether it be things like hypertension, diabetes, or mental health issues. And so we know that this care is vital not only for the health of moms, but the health of babies, because we know when mom's healthy, baby's healthy. Like I mentioned before, COVID-19 has had a significant impact on perinatal health in the state. And a lot of times you have people, when they are covered by pregnancy Medicaid, they may have been uninsured beforehand. So we want to make sure that we can get them the care for as long as possible. And we also know that this will help in reducing maternal mortality in our state, as we have some of the worst rates in the country. Most of our deaths that are related to pregnancy that we see in the state are preventable, especially the ones that are happening from 6 months to a year. So we want to make sure people have access to care to prevent these deaths. Next, we have workplace accommodations. And workplace accommodations is really a broad term, and apologies for the typo in the first bullet. That should say that there are no laws to protect pregnant or postpartum employees in the state. And we know if somebody is showing up to a job interview and they're visibly pregnant, that shouldn't bar them from getting that job. If somebody is employed and they become pregnant or they're postpartum, that shouldn't affect their ability to work or their work hours or get them fired simply because of their perinatal status. So we want to make sure that people are protected from discrimination. We also know that there are no laws that provide basic accommodations to pregnant and postpartum women. Last year, we were happy to see the breastfeeding bill, which allowed for employees to express breast milk on the job. And that's great, and it's a great first step, but we want to see laws that protect pregnant employees as well. So having a place to sit, having more food and water breaks, bathroom breaks, and lifting restrictions, just being able to support a healthy pregnancy at work. And we know that this legislation is business friendly. Employers spend a lot of money when it comes to turnover or training costs, and we know that people are far more protected and far more willing to work and stay at a job if they know that their jobs are secure, regardless of if they get pregnant or not. Last but certainly not least, we have tobacco and vaping taxes. You might wonder, why does a maternal infant health organization care about smoking? Well, we know smoking and the impact that it has on Georgia's moms and babies. We know that it puts babies at an increased risk for SIDS. It puts babies at an increased risk for being born preterm and having negative outcomes. And it also puts mom at risk for several reasons. In the state of Georgia, we have some counties where, believe it or not, close to 20% of moms are smoking during their pregnancy. So while if you look at the overall state of Georgia, that rate might not be high, it's not equal across the state. We also know that Georgia has one of the lowest tobacco taxes in the country. The only state that has a tobacco tax rate lower than us is Missouri. And so we're a state for cheap tobacco, for better or worse, however you look at that. But we know that raising the tobacco tax to the national average will bring in about $500 million to the state. We really need that money now, especially given the fact that COVID-19 has negatively impacted our revenue as well as our overall economy. And just generally speaking, like I mentioned, given the fact that smoking negatively impacts perinatal health, we are all for tobacco and vaping prevention efforts as well. So that concludes our legislative priorities for the session, and we're really pumped about getting you all excited and involved in our advocacy activities, and we'll have some opportunities that we'll talk about a little later in our presentation about how you can get involved in that. And if you'd like to contact me, feel free to reach out. My email is on the screen. And if you'd like to engage with us on social media as it relates to the session, please feel free to do that as well. Next, we'll have our pre-recorded legislative panel where legislators will answer some questions that folks sent in about what's on the horizon as it relates to maternal infant health for this session. So I will turn it over to the panel.
Appreciate the fact that we have advocates who are still willing to raise their voices. And so one of the main ways you can participate is that a lot of our meetings will be held via Zoom, committee meetings, and you are more than welcome to sign up for public speaking via Zoom. It is actually, you can access it from your phone or your computer, but it is a way to still have your voice heard in the process, to let legislators know that you are still concerned, that you are still advocating, and that we are finding creative ways to do it.
The number one piece of advice to advocates, other than to continue advocating by calling your legislators, emailing them when it is appropriate, joining the opportunities, for example, virtually to do legislative lobby days. Besides all of that, my number one piece of advice, particularly when you're contacting legislators, is to identify yourselves as constituents. Because we, on the legislator side, we do see a glut of information and advocacy from many, many people, but we are elected by our constituents. So we have to pay particularly close attention to what our constituents are saying. So make it easier, if you would, for us to know if you are a constituent, because that makes sure that your opinions will be seen by your legislators.
Well, I think, this year does present a lot of challenges in terms of, because, like everything, face-to-face interaction is meaningful. And so that makes it harder to advocate, I think, in some ways. But, we're all used to Zoom meetings, and we're used to telephone calls and those sort of things. So I would just encourage folks, set up a Zoom meeting, get to know your legislators and advocate on the issues that we're working on. Like, I know that your organization is supportive of our paid leave bill for state employees to give our teachers and all of our state employees 3 weeks of paid leave. And so, talk to your legislators about that bill. I'd ask for your help. Y'all have been real supportive, and we appreciate it. And so I'd ask your members, reach out to your legislators and advocate for that bill and the other things y'all are working on. And so, just because it does look different in some ways, you can get more done with Zoom, because you can be meeting with somebody here and about 5 minutes later meeting with somebody across the state. And people are so used to it that it offers some positive parts to it as well. But just would encourage you to keep in touch with your folks, and people are receptive, and it looks different. It is different. But I still think we're going to get a lot of good things done this session.
It's very strange down here right now because there aren't many members of the public down here. Public's not allowed in the galleries. The good news is people need to get very familiar with our legislative website, legis.ga.gov, because that is where they can track legislation. They can find the information for their legislators and contact them directly through the website. So that's a great tool. And then the other thing is we're all here, we're getting tested twice a week, and we're following social distancing and masking and all those things, but our staff is here as well. And so they can still call, but when you make an appointment, it is likely going to be for a phone call. Or I would also recommend getting very good at Zoom, because I'm Zooming with a lot of people instead of having face-to-face meetings. So I think that is, actually, we're going to find that that's going to be very valuable, but I think all of us miss the contact with the public that we normally have. So hopefully, maybe by next year, we'll be more normal. Fingers crossed.
So as I reviewed the data for my district, it was very alarming, but it wasn't surprising. And I'll say that because there is room for improvement. And I'll say that because we can do more in Georgia when it comes to healthcare, and the full expansion of Medicaid would alleviate and would make room for improvement to bring these numbers down, bring them down in the communities where they're very high. So that says a lot to access. That says a lot to affordability. It says a lot to the fact that there is a misrepresentation or less of representation of the medical field in these areas. And so our health clinics are doing all they can, but we could do more in the state of Georgia to fund those agencies. And I believe that will bring the numbers down.
It's interesting, the data for my district, I actually believe underreports the severity of maternal and infant outcomes. And I think that speaks to part of the problem, which is actually data collection and how we present data to the public. I see improvement even from that perspective. Beyond that, you don't need to know the specific district data on these outcomes to know that my particular district is heavily underinsured. In fact, as of 2018, this is before COVID-19, about 43% of people are uninsured. And when I canvass and talk to people, I know a lot of mothers went through their pregnancy without health insurance. So there's certainly a big deal of improvement to be had to ensure the best possible outcomes for districts like mine, which again are very, very under-resourced when it comes to healthcare, and that particularly has an impact on maternal and infant outcomes.
Well, obviously, I'm glad that our district is below in a positive way, below the state averages. So our district is Clark, Oconee, Jackson, and Bureau counties numbers are a little bit better, but across the state we've got work to do, and even in our district, even the numbers are better than maybe other parts of the state. That I mean they're where we want them to be, and so we've got more work to do there, and so that's something that I think you'll continue to see a priority of the General Assembly, and I know that that's something that is meaningful to me, and because it impacts families and seeing the numbers and the statistics really brings it home when it's your district and you see exactly, in House District 117 what our numbers are. And so I always appreciate when y'all share that data with us because I think it's really valuable. And so thanks for doing that, and let's all work together to improve all our numbers across the state.
I think trying to pull this data together is a great project. I think that it really helps to put some numbers that you can compare between districts. That said, I think I need a little more depth on what the numbers actually mean. My district is probably in a lot better shape than a lot of other districts around the state. The metro Atlanta area tends to have some advantages that we don't have in our more rural communities. And I don't really know what all the definitions are on here, so I don't really know exactly what you guys are calling adequate prenatal care, for example. So I'm happy to see this snapshot of the data, but I'd really like to have some more depth on the data for each district. And I'm sure that exists because you had to have that data to crunch it into a summary. So many of the legislators who aren't very involved in the healthcare world may not want all the detail. I would like to have the detail.
I absolutely will support extending postpartum to 12 months. And I believe that it is possible because there was no conversation around it before. There was no knowledge of it before. There was, not having conversations or not communicating is a barrier. It's a barrier. So not having that conversation before um, became an eye opener to people whenever they finally heard the news about this travesty. And so I do and will support a 12-month extension. If we can get more, we'll take more. But at the end of the day, I believe that where we are in our session and where we are with our leaders, with people being able to understand what happens, how it happens, what we're doing, I think that we can get the support that we need. And at the end of the day, I do believe that we will get the 12-month extension because it is necessary. And unless it has been something that had not been discussed before, I don't think we would be here where we are now. So yes, I will fully support it.
I am, of course, absolutely supportive of extending postpartum Medicaid to 12 months. We know how important that is. The question, of course, is how realistic is that as a possibility? And it's going to be a fight because in this budget environment, there are many services, agencies, et cetera, that are fighting for limited funds. So with that, I urge advocates to continue to ensure that their voices are being heard so that the funds will be appropriated for postpartum Medicaid. And that's something that is very important because COVID-19 has made a problem that was already bad worse. And it's going to be a problem that has obviously impact for generations. So make sure that your voices are being heard to ensure that those funds are being appropriated to postpartum Medicaid.
Well, last year, that piece of legislation was something I was really proud to support, and obviously the money in the budget, I think that really positive, and so I'm excited about where we're headed on that, and I think it will help with our maternal mortality and some of the other challenges that we face as a state, and so I think that was a really good step forward. Certainly, we do have more work to do, but I was proud to support that and hope we can continue to make progress, and that's something that I think was a really good step forward. And Sharon Cooper has just been a champion on that, and the speaker and so many other folks have been working on that and trying to get our maternal mortality rates down and supporting families and so that's what we're going to continue to do.
I think many of us, all of us were very happy that we were able to extend postpartum Medicaid to 6 months last session. I think it was the bill was not so much the issue as the funding was the issue. And I was actually very surprised that our budget folks were able to work together to find enough money to extend the benefits to 6 months. I think everyone would like to see it go all the way out to a year. The money is always the problem, and there's so much need just in general right now that I would be surprised if we got there this particular year. We do our budget a year ahead of time, and we probably won't have our next economic adjustment of the revenue numbers until May. And so I would be surprised if we were able to get enough money to do that in the budget upcoming.
So glad to see that being put in the budget. But I do know that we will have to continue to advocate for it to stay there and to extend, because if we're going to extend the 12 from 6 months to 12 months, we would definitely have to extend the funding for it. And so I see it staying in the budget because we have leaders on the front line, including myself, who will ensure that we serve the people of Georgia and all the people of Georgia. And that includes those who are in underserved communities and who are affected by infant maternal mortality. And that gives us the support that we need to keep those monies in the budget and extend them. And so I'm grateful for the conversation. I'm grateful for questions from my colleagues who don't understand. I'm grateful for the platform to make this a topic of discussion, a tabletop discussion, and for us to continue to work together, work alongside each other to move Georgia in a forward way, so that we're not just known as the number one state to do business, but we'll be known as the number one state to combat maternal mortality.
I think it's going to be a rough environment. Certainly, we know that's true for healthcare in general, and again, particularly for maternal and infant healthcare. It's going to be a very rough environment, even if no further budget cuts were made. We know that that's a reality, and there's always going to be that threat. That said, I do see a lot of room for improvement. Of course, I fully believe, and I hope you fully believe, that we need to put the right amount of money there. But I think so much of what we can improve on is something I'm always talking about, because I represent a district that's about 53% immigrants and where 1 in 4 households have so-called limited English proficiency. What can we do to make information about healthcare, even resources that already exist, more accessible to those kinds of populations? I think there's a lot of room for improvement there that is close to cost neutral. So I hope we're fighting for that as well.
Well, I think that the budget is something that we're still working through. We just passed the amended budget for 21, and we're able to restore some funding across the board in different areas. And so revenue, Georgia's in a fortunate position, frankly, compared to some of the other states. We're seeing other states that they're having to cut. And Georgia, we're actually able to increase our investments in healthcare and education and transportation and broadband and some of these other areas. And so I'm excited about that, but it's still obviously, we're still in a tough economy, and we don't know what the future looks like. So we have to be smart as well. But I think because of the leadership we've got in Georgia, we're in such a better spot to invest in these important issues than some states across the country where you're seeing cuts, right and left. And so I'm looking forward to getting a budget through that does prioritize healthcare and some of these other issues. And so, looking forward to that. This year I'm excited to be on appropriations and working towards, getting that budget through. And, we'll be looking at that FY22 budget really soon. And we started looking at it, but in terms of having subcommittee and committee and those sort of things. So I think you'll start to see a lot more information about where we're heading and those sort of things very soon.
Well, I think that the appropriations folks, and I'm thankful to be on the appropriations subcommittees now for health, community health, and human services. And the budget started out flat for all of that. And we have been able to add money back into the system already for the amended budget as it relates to public health. And of course, maternal mortality lives inside of public health. So I think there's a recognition that public health and all the services within that need extra help right now in light of the pandemic. There's a lot of need in more areas, certainly mental health as well, and substance abuse and a lot of other things that we take care of in our appropriations budget. So it's a balancing act. And as you know, we add money to one program, it comes out of another program. And so there's a constant tug of war about who gets what. But I think the public health issues have been front and center this year. And I think that's ultimately going to help moms and babies as well.
It's so important to continue advocating for maternal and infant healthcare. First of all, and most importantly, because there are mothers and their babies suffering because they don't have access to healthcare. And again, this was a humanitarian problem before COVID-19, but COVID-19 has only made it worse because, as we know, COVID-19 has made healthcare more limited. Some of that is necessary because of the restrictions and protections we need to have in place. But the reality on the ground is it's very restrictive and there's a lot of uncertainty, but we know that this is going to have impact literally for generations to come. It's going to have an impact on the mother and her ability to provide a livelihood for herself and her family. And it's going to impact, obviously, the infant as it goes through the various stages of the lifespan. So this is something that, not in spite of COVID-19, but especially because of COVID-19 and the way that that has exacerbated the disparities, we need to continue fighting for, because it will have an impact for a long time if we don't.
I think in the midst of a pandemic, there's no more important time to advocate, for maternal and infant health. And for me, I think that now is the time to do things like our paid leave bill for state employees. That's going to help new families and mothers and children, and so that's something that I want to continue to advocate for, and grateful for advocates across the state who are working on these important issues. And so I think right now is more important than ever to work on this issue. So I appreciate what y'all do, and grateful for y'all having us, and wish we could be together in person. But look forward to having the opportunity to do so in the future. So any way we can be of help, let us know. But thank you all so much for what you do.
Well, what we've learned that in the pandemic, life goes on, and that a crisis brings out problems that we already knew we had, but the problems are even more so during the pandemic, because people are so limited on where they can go and what they can do and how they get their medical care and a lot of other things. So I think really the pandemic, there's somebody that said, don't let a good crisis go to waste. And that sounds sort of strange, but I think it is an opportunity in some ways to identify the weak spots in our system, because the ones that were already weak are weaker during the pandemic, and we need to shore those up. So I think it's given us a chance to really focus on how to improve specific things that have turned out to be a bigger problem than we even knew.
We are so thankful for our legislators that participated in this year's panel. If y'all have any questions that you would like to ask of our legislators, please feel free to reach out to them, or you can reach out to myself and I can help in making that connection, so we make sure that any questions you have about anything they mentioned or anything they're working on gets answered. And apologies for the audio issues with Senator Anderson's video. A little bit of audio was blocked due to the fact that she was wearing a mask. So we will try to provide a transcript once we send a recording out of today's event. So now it's time for our advocacy training. So I will start off just by talking about the 2020 session. It was a hectic time, to say the least, for a lot of lobbyists, advocates, and legislators on the ground, just due to everything going on with COVID and budget cuts. So I cannot stress enough the impact that budget cuts had on last session. Even before everything happened with COVID, the governor called for 10% state agency cuts across the board. And of course, going into session, we had to prioritize what we wanted to be put in the budget as it related to maternal and infant health. Once COVID hit, the governor asked for an 11% cut in state agencies. So that was a cut on top of a cut, which is, of course, never good. So when we talk about prioritizing saving maternal and infant health funds, that definitely becomes a factor then. It was also an election year, and sometimes this can work in your favor, sometimes it can work against you, because you'll have legislators depending on the bill, that may be more supportive of your legislative priorities due to it being an election and them, trying to win that election, versus other bills where they may stay away from a little bit more because of how it will affect their chances of winning re-election. It was also the end of a biennial session. So Georgia operates on a 2-year legislature. And essentially what that means is in the first year, so we are in the first year of that biennial session, any bill that's introduced introduced is still in play for the next year. So last session, any bills that were introduced in 2019 were still in play, but once the 2020 session ended, those were out of play and would have to be refiled again. And last but certainly not least, of course, COVID impacted things around the session. We suspended around mid-March, so we got the announcement on crossover day, and I'll go into a little bit about what crossover day is. And then once we came back, there was limited in-person activity. But we did see a lot of big wins. So like I said, it was a crazy time for all just with COVID and budget cuts, but we saw a lot of great things happen for moms and babies in the state. We were able to see the passage of House Bill 1114, which extended pregnancy Medicaid to 6 months. We saw the breastfeeding bill, which allowed for employees to express breast milk while on the job. And we saw the extension of the Family Care Act. And the Family Care Act essentially allows employees to use their already accrued sick time to take care of family members that are sick. And so that was set to expire last year, but it was extended to 2023. And last but certainly not least, we saw vaping products being taxed, which they previously were not. And that's estimated to bring in about $50 million in new revenue, which the state really needs at this time. And we also, like I mentioned, saw about $4.12 million in maternal health initiatives that were up for cuts, and we were able to retain $3.61 million of that. And last but certainly not least, with postpartum Medicaid extension, sometimes this can happen where a bill passes, but there's no money put behind it. And so there was kind of concern that that might have happened when it came to pregnancy Medicaid extension, but we're really happy to see $19.7 million allocated for that. So next, some context for the 2021 session. As y'all know, COVID has impacted a lot. We are monitoring the budget, like I mentioned, to make sure that maternal infant health priorities are protected. And ideally, if we could get new money put in the budget for programs, that would be amazing. We do not encourage folks to go down to the Capitol, but if you do, or if you're interested in going down, just understand some of the context that's happening. There is construction going on, so that may affect some of the entrances to the Capitol, and it's also heavily guarded due to the events of January 6th. And last but certainly not least, there are COVID-19 protocols, which have limited in-person activities. So if you go into a legislator's office, you have to wear a mask and you have to have an appointment. So if you're going down there, make sure that you've scheduled an appointment, because I would hate for you to go through, well, there's not too much traffic now, but I would hate for you to go down there and not have an appointment and be turned away. And just understanding what legislators are looking at, they're focused on the budget, COVID-19, and election legislation. That's not to say that they aren't prioritizing and moving things forward in other areas, but this is a focus for legislators down at the Capitol and advocates alike. Next, I just wanted to do a brief overview of how a bill goes from an idea to law in the state of Georgia. And I know this is a really complicated process with multiple steps, but I wanted to highlight 5 main points. So the first, a legislator either gets an idea, or a group, a constituent, or an advocacy organization brings an idea to them. Once that idea gains ground, it then goes to committee. So there are some steps, of course, that happen in between, and that includes it being called to the floor, it being assigned to a committee, and then once it reaches committee, which is not guaranteed, just wanted to throw that out there. Not every single bill that's introduced and assigned to a committee actually gets a committee hearing, and you'll actually see a lot of times bills unfortunately don't. But when bills do make it to committee, about 1 of 3 things can happen. The bill can be essentially rejected by the committee, and sometimes that could just be because there are concerns with the bill, it's voted down by committee members, and so it does not move forward. The bill can pass, but with substitutes or amendments, and so that happens when there are tweaks that need to be made in the language. So for example, there was a hearing on Senator Randy Robertson's Maternal Supportive Housing Act, and there were some issues that folks had with the language around mothers allowing their children, and it didn't have any specifications that it's minor children, so minor was added to the bill. So it could be little tweaks like that, or it can be big enough to where the committee says, hey, let's take a step back. You go back to the drawing board and come back and present your bill to the committee. And last but certainly not least, the bill can just pass. It comes to the committee, they think it's fine as is, and it passes through with no issues. Next, the bill is then called to the full floor for a vote. And from there, there is a certain day for the bill to cross over from either the House to the Senate or the Senate to the House. And that day is known as crossover day. It's a really great time for everybody. Legislators, advocates, and lobbyists are typically running around the Capitol. Last year's lobby day or crossover day, I did not leave the Capitol until about 1 o'clock in the morning. So that just gives you a sense of how crazy it can be down there. And essentially, if a bill does not, if it was presented by a representative, so it was presented in the House, if it was presented by a senator, it was presented in the Senate. And if it does not cross over from one body to the next by the end of this day, it is considered dead. There are some exceptions, but for the most part, the bill doesn't move forward beyond there until the next year for the biennial session. And then once it crosses over, that process happens all over again. It's called to the floor, it's assigned to a committee, and if it passes committee, it goes to the governor's desk. And once it goes to the governor's desk for consideration, the governor can either sign the bill into law, he can ignore the bill and it automatically becomes law, or he can veto the bill. And if he vetoes the bill, the only way that that can be overturned is if 2/3 of each chamber, the House and the Senate, vote to do so. And then last but certainly not least, the bill is law. So this is typically when you'll see us having our thank you campaigns to our legislators, and you'll also may see some education like, hey, the breastfeeding bill is now a law. What does this mean for employees and employers across the state, which you will be seeing coming from us soon. Next, as Senator Kirkpatrick mentioned, legis.ga.gov will be your best friend when it comes to this session. I know advocates that have used this website are really happy about the recent update that it had, and it's a lot more user-friendly and a lot more easy to track down bills, track down what's going on at session. You can see the video where you see the off-air screen. If you log in on a legislative day during the time that they're in chambers, you can watch that live. You can also use those tabs at the top to track down legislation, find representatives, find senators, and also find folks in committee, and you can use that search bar to look for legislation. Once you find your legislator or you find a legislator that you're interested in having a conversation with, you can go to their page and you can see all of the information that you can gather from this. You can know what district that they live in. So if you wanted to use the Project 236 sheet for Representative Park Cannon, you can pull down the sheet for House District 58. You can see what party they're in, what region they cover, and then if they have any special leadership positions, you'll see that there as well. You'll see their Capitol address, which will let you know which office they're in and which building they're in. So she is in room 512F in Coverdale, which you'll also hear referred sometimes as CLOB or CLOB, and that's where most of the legislators' offices are, and it's right across the street from the Capitol building. You can also use that phone number to call as well, and I would highly recommend that. And you can also email, and if you email, please be sure to include their staff as well. Legislators are really inundated, as they mentioned before, with email, so make sure that their staff is included. You can see those tabs at the bottom, learn about their bio, see what committees they're in, and any sponsored legislation that they have. Next, this is what the page would look like for a bill. So this is for last year's Pregnancy Medicaid Extension Bill, House Bill 1114. And you can use that bar at the top to review the bill. So it'll have the bill in its entirety, the current version as well as past versions. Next, you can look at sponsors. So if you want to contact Jan Jones and ask, oh, well, why are you interested in this bill, or what can I do to support this bill? You can contact all of the sponsors. It also has sponsors for the Senate because a bill has to be sponsored by somebody in both the House and the Senate once it crosses over. And so that was sponsored in the Senate by Kay Kirkpatrick. And you can also look at committees. So whichever committee it's assigned to, and that way when you go to the calendar, you can look at agendas for committees. And the website is really good at making sure that agendas are up and ready, given the fact that a lot of people are watching session from home. So you can see if there's an upcoming committee hearing on the bill that you're interested in. This is what will happen if you scroll down a little bit more on the site. You can look at the first reader summary, and this is essentially just a snapshot of the bill. I will say sometimes you'll read this and still not understand what the bill means, or what's in the bill. So if you need a little bit more information, you can go back and look at that current version of the bill. The status history will give you a play-by-play of what's happening with the bill. So where is it now? You can see with House Bill 1114, where it started off in the House and then it moved to the Senate. And you can see when the governor signed it, and then you can see which act it became when it became law. And last but certainly not least, when the bill is heard in the full chamber, so either the full House or the full Senate, you can see the vote on that. So you can see the yays, the nays, the not votes, and then also people that were excused on the day of voting. So if you wanted to click on that and say, hey, why did you vote against pregnancy Medicaid extension? Of course, do that respectfully. But if you wanted to contact a legislator that voted on your bill just to learn a little bit about why, you are certainly welcome to do that as well. So now that we understand how to track bills and how to contact legislators, these are just a few tips given the fact that we are in a virtual age. I will say this is as new to me as it is to you, as this is my first virtual session, but these are just some things that I have found works for me and what I've heard from other advocates and what works for them. When you call a legislator, make sure you follow up with an email if you don't hear back from them, and then call again. As was mentioned, legislators are really inundated with emails and calls right now. So don't feel like you're pestering them and you're bothering them. If it's important for you to get in contact with them, make sure you do that. Don't be afraid to use Zoom. Of course, legislators have become a lot more savvy when it comes to Zoom. As was mentioned by Senator Kirkpatrick, if you're interested in signing up for testimony through Zoom, you can go ahead and do that, and we highly recommend you do so. Don't be afraid to @ your legislators. And what I mean by this, don't be afraid to call them out on social media. And I say call them out in a respectful way, but if you're watching a committee hearing and Representative Gaines presents the Paid Parental Leave Act and you want to thank him for that, feel free to do so. He's on Twitter, and so are a lot of other legislators. So don't be afraid to use social media as a tool as well. Be creative in your subject line when you're sending emails. They're getting a lot of emails right now. There are some legislators that are getting hundreds of emails a day. So if you want to talk about a particular bill, don't email with the intro or a subject line that just says meeting or introduction. Be specific. Say House Bill 146, Paid Parental Leave Bill, and then in the subject or the body of the email, just kind of elaborate on what you want to talk about. But they know and have a sense of what you would like to discuss based off of that subject line. And send mail or postcards. I know things are a little uncertain with the Postal Service right now, but I'd still recommend that you send mail and postcards. Legislators aren't obligated to answer and open all of your emails, but they are obligated to open their mail, or at least their legislative assistants are. And we actually have a postcard project related to workplace accommodations that we will be sharing in a follow-up email. So if you would like for us to send a postcard about why workplace accommodations are important to you on your behalf, we will be happy to do that. And as Representative Lim mentioned, are you their constituent? If you are, let them know. Do not start off an email with, what you want to discuss without letting them know you are their constituent, because even though they represent the whole entire state of Georgia, constituents do take priority. And again, we do not encourage in-person meeting. Please do so at what you feel comfortable with and what you feel safe with. But if you're interested in meeting in person and maybe you live in Valdosta and it's a little harder for you to get to the Capitol, you can meet with your legislator in district. They have their district address there. And so if you'd like to set up a meeting in district and ask them for that, you can go ahead and request that as well. And use the toolbox that we sent you. We sent it in the email with the Zoom link for this day's event, and we'll also be sending it in a follow-up email. It has a lot of great one-pagers and a lot of great overviews on advocating in a virtual session. So if you ever feel stuck or you have some questions you'd like to ask, of course, reach out to us, but also we encourage you to use the toolbox as well. So you've got a meeting, and I use this picture of this baby relaxed, chilling in the pool, because essentially that's what I encourage you to do. Be yourself. I know talking with legislators can be really intimidating because of their role and their kind of power and status that they have in the state. But they're everyday people like us. They have day jobs throughout the year. A lot of them are teachers, a lot of them are nurses and doctors and lawyers. They have everyday jobs just like we do. So be yourself. Share your story. Only if you feel comfortable, though. Sharing of stories is a really powerful tool. So if you benefited from pregnancy Medicaid and you want to tell your legislator about that, feel free to. But if you don't feel comfortable, I would not recommend that you do that. Only share what you feel comfortable in sharing. Expertise is not needed. So you don't need to be an expert on tobacco tax or workplace accommodations or infant mortality to speak with your legislator. However, you do need to be prepared. So if your legislator asks you a question that you're unable to answer, just say, I don't know the answer to that right now, and maybe I will get back to you if you feel comfortable in following up on that. Or maybe just say, I'm not sure on that, but let me go ahead and connect you with somebody who might know. And you can connect them to me, you can connect them to Vicky, you can connect them to Betsy. There are a wealth of people that you can connect them to that may have those answers to those questions that they ask. Once the meeting's over, be sure to thank them for taking the time. Like I said, just given the fact that legislators are really busy right now, that is very important to do. And thank their team as well. If their administrative assistant helped set up that meeting or their chief of staff, be sure to send them a thank you email as well. And last but certainly not least, please follow up. If you said that you would give a legislator a resource or you said that you would answer a question for a legislator, just make sure that you go ahead and do that. For me, it's a lot easier as soon as I get home from the Capitol to just hop on my laptop and send them an email on whatever they requested, just so I can kind of have that at the top of my mind. And just a few things to keep in mind when it comes to talking points. Like I said, please use the toolbox. It has some one-pagers on workplace accommodations, as well as postpartum Medicaid extension. And we will be working on having a one-pager for all of our issues. And with the toolbox, it's a living document. You can access it at any point that you want. And if you see something in there that may need edits or you have feedback for, or if you don't see something in there that you feel would be helpful for people advocating across the state, please let us know so we can go ahead and update that. And like I said, please use Healthy Mothers, Healthy Babies and March of Dimes as a resource. If you have facts and figures that you would like to get a hold of, please reach out to us. And then also communicate why this issue is important to you. It's always really powerful when everyday community members say, even though I was not covered by pregnancy Medicaid, or even though I'm not maybe directly impacted by tobacco or vaping, this is why this issue is important to me. And also focus on the impact. So maybe you did benefit from workplace accommodations, but make sure you tie it into how it will benefit all moms and all babies and all families across the state of Georgia. So with the toolkit, I just wanted to highlight a couple of resources that are in there. First, we have our Project 236 initiative, and this is a new initiative. We launched it earlier this year, so it's brand new and it's our first iteration of it. And as some of the legislators mentioned, it is based on county level data, and we do have a note on that on each sheet so that legislators can see that. But to Representative Lim's point, because he may represent one part of Gwinnett County and that sheet has all the facts and figures for Gwinnett County as a whole, it could be a little skewed. So keeping that in mind. But legislators overall really do appreciate just having those numbers for their district. And I did see a comment about incorporating students, and I do want to give credit to some of our student volunteers that worked on this, including Bridget Whaley, who helped in identifying counties that were in each district, and also Ansley Kasha, who's on the call today, who pulled the data and also designed all of the sheets. And we could not have done this project without them. And we also took some feedback from Senator Kirkpatrick when it came to making sure that we had those definitions. So if you scroll down to the bottom of this page, you can see everything outlined from preterm birth, low birth weight, infant mortality, and prenatal care inadequacy, just so you can get a sense of what those terms mean, just in case a legislator asks you for that. And we will definitely take into consideration contacting students as well as just public health schools across the state so that we can get a little bit more specific when it comes to districts, especially since we're about to redistrict later on this year. We also have the March of Dimes report card in the toolbox, and that gives a general and really honestly detailed overview of preterm birth and infant mortality in the state. It has facts and figures by geography. It also has some information when it comes to things being broken down by race and ethnicity, which is really important because we know that Black infants in our state are disproportionately affected by preterm birth and infant mortality. So it's good to have that information on hand. But you can use both of these resources when you're reaching out to legislators and say, hey, Chairman England, I want to talk to you about your district and ways that we can improve your preterm birth rate because it may be lower than the rest of the states. Or maybe it's really good and you want to say, I would like to talk to you about how you can maintain these positive outcomes and also just improve in the future as well. And last but certainly not least, we have our Keeping Current at the Capitol campaign, and we will be sharing this in a follow-up email about how you can sign up for this newsletter. We send out weekly legislative updates, so it includes updates on bills, legislation to watch. We also have events such like this event that we advertise in the newsletter as well, and we also just keep up to date tracking of bills. So it comes out every Tuesday, and the information that's covered in it is through the Thursday of the previous week. So you may have seen in the previous week a bill was introduced, and we'll have an update if that bill made it out of committee or was assigned to a committee. We also have all of those legislative tools that I mentioned, including Project 236, how you can find your legislators, as well as a summary of the previous session, and just generally how you can get involved in advocacy and maternal infant health in the state of Georgia. And that is all that I have for you today in terms of trainings, but I would be happy to answer any questions. Feel free to pop those in the Q&A or the chat. And I did just want to answer a couple of questions that we saw earlier. The percentage of maternity care deserts was 50%. So we have about 50% of counties in the state that do not have OB care and do not have those resources for people to have healthy pregnancies. The slides and the recording for this event will be included in the follow-up email. And also there is a bill on tobacco and vaping that was introduced by Chairman Ron Stevens last week, and that is House Bill 349, and we will be tracking that and keeping current too. And I also saw a question in the chat about if we are doing anything around doulas being covered by Medicaid or private insurance, and we definitely are. We are working with Representative Park Cannon, who was one of our Charlotte Wheelan awardees this year, and she's actually a doula and a childbirth educator herself, so of course, who better to go to? And so we're hoping that we get a bill this year, but if we don't get a bill this year, we for sure will have something dropping next year. So please be on the lookout for that. I don't see any other questions, but if there are any, feel free to pop it in the Q&A function, and we will be sure to get to that either during this session or afterwards. So now I will turn it over to Kai Lindberg, our new executive. Oh, sorry, there is a question. Have all legislators received their 236 data? Yes, so legislators receive that through the Keeping Current. We send that newsletter to them as well. But before crossover day, we will also make an effort to go ahead and send each individual legislator their fact sheet as well, and just some information about how they can improve that because it includes our legislative agenda on it as well. When is the next briefing for health committees on maternal and infant mortality? So that's a great question. We did have the maternal mortality study committee that took place in the fall of 2019. And that was done through a resolution that was passed by the House. And so we don't have anything in the works related to that, although last session there was a bill introduced to look at infant mortality and maternal mortality, specifically in African Americans across the state. So if something like that passes, we will definitely have that briefing. But there are always, House Health and Human Services committees, as well as the Senate Health and Human Services Committee that will have briefings, just depending on what the bill is. So for example, when Representative Gaines presented his paid parental leave bill. There was a lot of conversation on why moms and parents in general need more support when a child is born, when they adopt a child, or when a foster child is placed in their care. So I would consider that a briefing for sure. So it kind of happened throughout the session, but any important ones that will come up, and if we need a call to action from folks, we will definitely send out an action alert on that as well. And so now I will turn it over to our new executive director, Kai Lindberg.
Thank you so much for the warm introduction. And what a dynamic exploration of how we can leverage our respective power to be in service to the mothers and babies across our great state. As many of you may know, for over 45 years, Healthy Mothers, Healthy Babies Coalition of Georgia has served as a nonprofit with a fierce commitment to improving maternal and infant health. During these unprecedented times, we recognize just how critical it is to not only provide direct resources and education to families, but also bolster the workforce and reduce systematic barriers to ensure that every mother and child has access to resources for a healthier life. We know that this session looks different than those in the past, but whether in person or virtual, we will continue to ensure that our voices are heard. I realize that my esteemed colleagues have shared a great deal of information with you. And as you walk away from the session today, I encourage you to thank your legislators who worked to improve maternal and infant health in our state. Additionally, if you're interested in staying engaged in our advocacy efforts and activities, we will be sending a follow-up email to all registrants that will include the Toolbox Amber referenced, an evaluation survey for today's program, and an opportunity to advocate for workplace accommodations with our postcard project. In doing our part in expressing gratitude to our legislators, we would like to share a brief video highlighting several of the 2020 Charlotte Willing Maternal and Infant Health Advocates of the Year. Chairman Butch Parrish, Representative Park Cannon, Chairwoman Sharon Cooper, Chairman Brian Strickland. We thank you.
I can't tell you what an honor it is to be honored for the second time from the Healthy Mothers, Healthy Babies Association. Being a nurse and having taught OB nursing one time in my career, mothers are extremely important, and so are their babies and children. You know, I grew up, I lost my mother when I was 12. I know what that did to my life and what a difference it made. And I cannot imagine what it would be like to lose my mother at a young age. And that is what motivated me, or one of the things that motivated me, to work so hard on our maternal mortality issue and to actually get $20 million in funds to support a 6-month expansion. It's not the year that we wanted, but it's a beginning. And I will continue to work on issues for mothers and babies as long as I'm a member of the legislature. So thanks to everyone again for this wonderful honor. Thank you.
Wow, I am so thankful for this opportunity to thank you for recognizing the work that goes into working for two. As a labor doula and a childbirth educator here in the state of Georgia, I would like to thank all of the Charlottes, especially the one who this award is named after, for making sure that lawmakers are paying attention and are being understanding of how difficult these times really are. We certainly do not want any person of childbirth experience to have to choose between a paycheck and a healthy pregnancy. So I look forward to continuing to learn about these issues and to hear from healthy mothers, healthy babies. Thank you again and have a great day.
And thank you, but it really has been a team effort. There are a lot of folks who want to work to help with this and realize the importance of this. And I think a few years ago, we all sort of got a wake-up call when we realized that Georgia was at the bottom of the list in what we were doing for healthy mothers, healthy babies, maternal mortality, and this sort of thing. And we began working to try to move that needle and put Georgia on the right track. And I think most of us have come to realize that we can spend a little money up front and make sure we try to get that prenatal care for that mom and take care of that new baby. Saves a lot of money in the long run and a lot of heartache and pain and suffering along the way, and helps us produce healthier mothers and healthier babies. And we're just proud to be part of that.